Hello everyone. Today we are going to discuss MCQs on cohorting. Cohorting is a critical strategy used during outbreaks or when managing patients with transmissible infections. This information can be used for educational purposes and staff training. Question number 1. What does cohorting mean in infection prevention and control? We have 4 choices. A. Assigning patients to single rooms regardless of their infection status. B. Placing patients with the same confirmed infection in the same room or area. C. Allowing visitors to stay overnight. And D. Using the same equipment for all patients. We are going to wait for a few seconds for the correct answer. And the answer is B. Cohorting means placing patients with the same confirmed infection in the same room or area. Question number 2. When is cohorting typically used in healthcare settings? A. When there are extra private rooms. B. When patients need quiet environments. C. During outbreaks or limited isolation resources. And D. Only in long-term care facilities. And the answer is C. Cohorting is used during outbreaks or limited isolation resources. Question number 3. Which of the following is most appropriate for cohorting patients? A. 2 patients with different infections but on the same antibiotics. B. 2 patients colonized with the same multi-drug resistant organisms. C. A patient with diarrhea and a patient with pneumonia. And D. 2 patients who are friends. And the answer is B. 2 patients colonized with the same multi-drug resistant organisms are usually appropriate for cohorting. Question number 4. What is a key requirement for safely cohorting patients? A. Matching blood types. B. Having identical diets. C. Confirmed diagnosis of the same organism. And D. Similar discharge dates. And the answer is C. Confirmed diagnosis of the same organisms is the requirement. Question number 5. Which of the following is true about cohorting healthcare staff? A. Staff can rotate freely between cohort and non-cohort areas. B. Staff assigned to cohorted patients should not care for other patients during the same shift. C. Cohorting applies only to doctors, not nurses. And D. Only cleaning staff need to be cohorted. And the answer is B. Staff assigned to cohorted patients should not care for other patients during the same shift. Question number 6. What is the main risk if cohorting is done improperly? A. Patients may become friends. B. Increased cost to the hospital. C. Cross-contamination of infections. And D. Staff dissatisfaction. And the answer is C. The main risk of if cohorting is not done properly is the cross-contamination or cross-transmission of infections. Question number 7. Equipment used in a cohorted area should be A. Shared across the entire unit. B. Cleaned weekly. C. Dedicated to the cohorted group or cleaned, disinfected between uses. And D. Disposed of immediately. And the answer is C. Equipment used in a cohorted area should be dedicated to the cohorted group or cleaned, disinfected between uses. Question number 8. Which of the following patients should not be cohorted? A. 2 patients with confirmed MRSA. B. 2 patients with the same strain of C. diff? C. A patient with an unknown infection status and a patient with VRE? And D. 2 patients with confirmed COVID-19. And the answer is C. A patient with unknown infection status and a patient with VRE should not be cohorted. Question number 9. Which infection is commonly associated with the need for cohorting during an outbreak in healthcare? A. Influenza. B. Chickenpox. C. Tuberculosis. And D. HIV. So answer is A. Influenza. Cohorting may be used during flu outbreaks when single rooms are limited. Question number 10. Why is cohorting considered a last resort rather than the first choice? A. It is more expensive. B. It can increase staff workload. C. It increases risk of transmission if not strictly managed. And D. It is not allowed in many countries. So the answer is C. It increases risk of transmission if not strictly managed. So that's all for today. Thank you for joining me.